Hello. Today is May 19th, 2012, and I thought I would make an update video because I haven't in a very long time. And where I'm at is I am exactly 1 year on testosterone, and I am 8 days post-op. So there's that. And I had planned to make a video before my surgery and after my surgery, and I'm not even going to lie, Tumblr has eaten my life. I've been using it to document things, so at least they're being documented, right? But anyways, so today I'm going to talk about the actual surgery day and the process of that. I had the surgery in Cleveland, Ohio with Dr. Medalie, and my surgery was on May 11th, and it all happened really, really fast. And I'll show you guys my chest afterwards so you can kind of see what it looks like now. But they pretty much, I went with my dad and my fiance, and we pretty much went back, or they sent me back into the room and had me put everything I owned into a biohazard bag, because I don't know. And I was laying there waiting, and I swear 8 people came into the room to ask me if I was allergic to anything, and it's like, no, as I've told the previous 6 people, I'm not. And then another person would come in and be like, hi, Kai, how are you? Are you allergic to anything? It's like, nope, still not allergic. But the one thing I was really worried about, and it's going to sound so stupid, first off, I am not scared of surgeries. I've had surgeries before, and some of them when I was really young, so the thought of surgery does not bother me because you're asleep for the whole thing, so what do you have to be afraid of? What I am afraid of are IVs, and that sounds stupid, and I'm not afraid of needles. That's an entirely different thing. I can get shots, I can get my blood drawn. For some reason, the last time I had an IV was when I was 6, and my memory of it is a huge metal needle that they stick in your arm, and I know that's not what they are. But the woman came in to do the IV, and I was trying to joke around with her and everything, and she was taking my blood pressure, and she's like, wow, your heart's beating really fast. And she's like, are you okay? And I'm like, I think I'm okay. And she's like, are you nervous? And it's like, well, I'm about to have surgery, so yeah, I might be a little nervous. You might be right with that. But and they made this whole big show about having someone else come in and talk to me to distract me so I wouldn't see the IV, because that totally is going to work because I'm not 20 and I don't know what you're doing. But they tried the whole this person's clearly 5 years old, let's distract them. But whatever, they were all very nice. I was not happy about the IV, and I made that very clear. But yeah, so I pretty much, and they drugged me too. I guess my heart was beating so fast that they felt the need to give me, they called it super Valium. I have no idea what it was, and I didn't like that either because I have a phobia about being drugged, so I probably would have thrown an absolute fit if I hadn't been so calm. And I think I told them that too. I don't really remember it well, but my fiance said that I said something along the lines of I'd be freaking out right now if I wasn't so calm. But I'm sure I was not their favorite patient. But yeah, so I went back to surgery and they put me to sleep, and I woke up and they let me lay there for half an hour while I got better oriented and stuff, and they gave me pain meds. And there was a woman standing there, and I don't even think she was my nurse. I think she was just trying to do work, and I kept I don't even remember it, but I remember that for the whole half hour I just kept asking her questions, and I have no idea what I was talking about, but I don't think she was my nurse, so I don't know who she was. I don't know, but she humored me. But I had the surgical vest on still, and that's something that I had to purchase beforehand, and they put on while I was in surgery. So I actually did not get to see my chest at all until the 16th, the Wednesday after that. So like 5 days later. Sorry, my computer fell asleep. So I had to wait 5 days to even see my chest, and the vest itself is slightly more uncomfortable than any binder I've ever worn. So that was fun, not to mention the fact that I could not shower for like 5 days, and that was terrific. And I had tubes. I have pictures of that on my Tumblr. I should have made a video and showed you guys, but I had tubes that went from kind of below my armpits, and I guess they like went down into like my chest and then like back out like through my armpits into like these blood grenade type things that had to be like emptied twice a day. It was gross, and I couldn't do it because, as I have found out, I'm not a squeamish person until it is me. And the first time that I looked at the drains, I actually had to like physically sit down to keep myself from passing out. So I am a very squeamish person, but only if it's me. Like, I feel like I could have done it with someone else and been fine. But so anyways, I went back on the 16th and got the drains out, and they took the vest off, and I still have to wear it for another week, I think, which I'm not looking forward to, and I actually am cheating right now. I just got out of the shower and I took it off, and I kind of have been lagging on putting it back on. But I'm probably going to put it on soon because I don't exactly know why I need to have it on, and I assume that if I don't put it on within like the next hour, I will die. Again, I freak out more if it's me. But I got to see my chest, and I was astounded at how good it looked. Like, it looks like I got hit by a car. It does not look like I had top surgery. It doesn't look like there was even anything there because I was able to have a version of the peri-areolar surgery where they just go around the side of the nipple, and they actually only went around like half of it. So there's literally like 2 incisions that are like maybe like an inch long, and that's it. So, but it's like yellow now. My chest is yellow from like the bruising, and it looks horrible. But that is basically my surgery story. And I wanted to show you guys this. You see? It's a little bear. Yeah, there we go. It is a little bear that says it's a boy, and this was waiting for me when I woke up. I guess my doctor thought it was like really funny, but my fiance got me this and a big like silver balloon that said it's a boy. And I mean, like, clearly that's like all the doctors or nurses knew like what I was there for, and so they all thought it was funny. But that was cute. All right, and now for the grand reveal. Thank you for bearing with me for like almost 10 minutes now, but so yeah, there's like hardly any bruising at all. The only thing that I don't like, I have no sensation in my chest at all. Like, it's completely right about like here, like right under my collarbone, I like lose feeling, and from there it's just gone. And he said that it'll take months, but gradually the feeling will like sort of resume. But anyways, that is my surgery story. So hope you all enjoy that, and take care.